still want to work on compression of those cells, and we want to work on increasing the compression load tolerance of the actual joint to a point where we're not getting a flare. The entire knee repair, not knee replacement program helps with this, and it really gives you this amazing situation. Someone in the chat said, this sounds really interesting and really incredible. And I agree. As someone who has worked with a ton of these patients who went through knee repair, not knee replacement, it's amazing to see the folks who have gone the route that we're having them go versus someone who says, for a while we were still doing physical therapy instead of VFit, right? And some of those people would just say, I have arthritis, I just want to do physical therapy. And really putting together the entire program, the people who did the knee repair, not knee replacement versus just like your standard run-of-the-mill physical therapy, it was a world of difference. And the acceleration in what people were able to do and get back to those functional targets that they had and those functional goals, it was a fork in the road. It was a complete difference between those two patients.